Hello, my name is Andre Lagron, and I'll be presenting on Operation Sea Spray. Tagline pending. So first of all, what is Operation Sea Spray, and why should we, as citizens of the United States, care? So, beginning in 1950, the United States sprayed the city of San Francisco with a series of biological agents and chemical analogs in order to determine the susceptibility of the city to large-scale bioweapon attacks. As a result of these sprayings, 11 people became ill and one person died, and there have been a number of far deeper and far longer-reaching ramifications to these tests. So beginning with some background that led up to the test itself, the US and the United Kingdoms were testing bioweapons together as early as the 1940s and sharing data between them in collaborations between Portsdown and Dugway Proving Grounds, as we've seen in Tucker's book. This closely mirrored and was tightly related to the collaborations that were occurring with respect to nerve agents at the same time. Throughout the 1950s and 1960s, there were a number of open-air tests conducted all over the world, both with live agents and with simulant bacteria and chemicals. Many of these projects that we currently know about were conducted by Dugway Proving Ground or by Project SHAD, which stood for Shipboard Hazards and Defenses. So, diving into Project SHAD, it was a series of tests that were performed from Dugway to Hawaii to the Panama Canal Zone. Many of these included the releases of deadly bacteria that would be theoretically used in biological warfare, including bacteria responsible for tularemia, Q fever, and a specific toxin that was produced by staph infections. They also tested nerve agents, including some familiar names such as sarin, tabun, soman, and VX. They also tested using simulants, which were designed to be benign and not actually harmful to humans, but easily identified in the environment. These included chemical simulants, including zinc cadmium sulfide, which was selected for its highly fluorescent properties, which allowed it to be easily detected on surfaces, and the biological agents S. maracasins and B. gobligi. So, what actually happened during Operation Sea Spray? From September 26th to October 2nd, 1950, a Navy minesweeper 2 miles off the coast of San Francisco began spraying the bacteria Serratia maracasins, referred to as S. maracasins, into the air. S. maracasins was selected due to its non-toxic, or theoretically non-toxic nature to humans, and its bright red pigment. Now, when the bacteria itself is spread throughout the environment, aerosolized as it was during the test, it's not visible. However, samples can be taken of locations, and if those samples are grown in a petri dish where you get a high concentration of the bacteria, you can see this very distinctive bright magenta pigment. It's actually quite beautiful. The test was intended to determine the susceptibility of a large-scale coastal city like San Francisco or New York City to biological weapon attacks. It was carried out without the knowledge or consent of the citizens of San Francisco. Local law enforcement was not informed. Local hospitals and other medical professionals were not made aware of the testing. And in the following days, after the initial spray, samples were taken at 43 distinct sites throughout the city and surrounding suburbs, and they found that the spread was much larger than they would have initially anticipated. It showed that much of the Bay Area became contaminated with S. maracasins to such a high concentration that had they been some of the previously mentioned toxic bacteria, there would have been lethal dosages throughout the city. So what were the immediate effects of Operation Seaspray? Well, again, like I said, local healthcare workers were not made aware of these tests, so they weren't prepared. But they did take note when 11 people suddenly came in to the Stanford Hospital with incredibly persistent urinary tract infections, all of which featured S. maracasins, which was a bacteria that previously was very rare in the region. It wasn't known to be part of the local microbial ecology. And with these UTI cases, they were able to treat most of them, but by November, one man, Edward Nevin, age 75, had died of his infection after the bacteria was able to get into his heart and shut down his heart valves. The military didn't say anything about the test, and citizens, including Nevin's family, did not find out what had actually occurred for 26 years. Many people actually speculate that the release of S. maracasins in San Francisco permanently changed the microbial ecosystem in the region. This is one of those long-reaching effects that I was talking about before. S. maracasins continues to show up in the area despite being wholly uncommon in the test. Again, it was not part of the local microbial ecology. In 2001, S. maracasins was a culprit in yet another public health crisis in San Francisco, this time killing 3 people and hospitalizing 10. They quickly were able to track down the source of the outbreak, and these deaths were due to massive infections from contaminated cortisone injections formulated in a local pharmacy. The pharmacy had been preparing its own injections, which is completely legal and well above board, totally fine, before you get all up in arms. However, a failure to maintain a sterile lab environment led to contamination with bacterial agents, including S. maracasins. When the cortisol was injected directly into the spines of customers, a rampant bacterial infection was able to take hold. Now, there was more than just S. maracasins that the samples were contaminated with. However, the overall infection that actually wound up killing 3 people was an outbreak within their body of S. maracasins, which again had only been introduced by the military testing during Operation Seaspray. So this is often attributed as a long-reaching effect and a direct result of the military testing, despite the fact the military didn't have anything to do with this particular pharmacy. Now, there is a number of implications to what happened and the aftermath of Operation Seaspray, and the impact has been pretty significant. Once again, the information regarding these tests was made public 26 years later in 1976, and this came out around the same time as information revolving around several other highly unethical studies, including the Tuskegee study, where hundreds of black men with syphilis were withheld treatment in order to study the progression of the disease. They were told that they were receiving injections of treatment, but it was just a placebo, and they were not able to consent to this. Many of them didn't know that they actually had syphilis to begin with, because they were not given that information. They were just being told they were being treated for, quote, bad blood. Public outcry about this, as well as other large-scale unethical testings, including chem and bioweapon testing on soldiers and volunteers who were given extra leave but not informed of the risks of the studies, and workers at the Nevada nuclear test sites who were exposed to radiation, and the communities downwind who were also exposed to high doses of radiation without any knowledge and certainly without consent. Public outcry regarding these number of different tests led to a series of changes to federal legislation that required the implementation of review boards to ensure that studies involving human participants would be wholly ethical, and generally cracking down on the idea of informed consent, and also leading to the full transparency of the doctor-patient relationship. Before these legislations were passed, it was entirely common for doctors to simply withhold information or lie to their patients, and in the aftermath of OperationSeaSpray, that was changed. In 2013, New York City did a similar test. They were trying to determine the susceptibility of their subway system to bioagent attack, and the New York City subway system transports millions of people every day. So it is an incredibly important location, and an area that if a bioweapon attack were to occur, it could be devastating. This test, with contrast to OperationSeaSpray, was conducted with full public knowledge before and afterwards. They used perfluorocarbon tracers, which are an inert, non-toxic substance known to be non-toxic. The details of the study were accessible to the public. People were able to come forward, ask questions at town hall type meetings, and the information was freely available, and the results of the study were immediately made public. As a local police department spokesperson said, there was never any thought of conducting the tests without announcing them in advance. From this, we can observe the massive cultural shift that occurred between 1950 and before, when these other studies were conducted, and after these studies became public. With the public outcry, it became clear that the citizens of the United States were not going to accept being treated as guinea pigs for scientific studies that could potentially be incredibly damaging to them without providing informed consent. And this is just one example of many studies that have been built differently based off of the lessons learned because of OperationSeaSpray.